Thank you for Professor Lamarca for his introduction, and thank you for the organizer of this meeting for his invitation, especially to Peter Cheillan. And I would like to present you the global overview of newborn screening in France. So newborn screening started in France in 1968, and our population is approximately 67 million inhabitants. And we have a number of newborn per year, approximately 760,000. We have 12 regions and a few overseas territories. And in France, newborn screening is mandatory. Actually, we screen for 7 disorders, 6 disorders on the Guilty cards, and 1 clinical screening for hearing disability. The global exhaustivity of this program is over 99.5%. Regarding the organization of newborn screening, we have at the regional level 17 regional centers with 16 newborn screening laboratories, which screen approximately from 25,000 to 180 newborn per year. At the national level, we have all the regional centers represented by a national coordinating center, and containing 2 commissions, 1 epidemiological commission in charge of the global evaluation of the program, and 1 biological commission in charge of the follow-ups of the biomarkers, the definition of new algorithms, and the setting of the cutoffs. Finally, in the Ministry of Health, newborn screening steering committee is in charge of the global political decision, and in association with the National Agency for Health Recommendation. So what about the result of the screening in France? We have for phenylketonuria a measurement of phenylalanine since 1972 with a global incidence of 1 to 16,000. For congenital hypothyroidism, we screen with a measurement of TSH since 1978 and with a global incidence of 1 to 3,000. For congenital adrenal hyperplasia, we measure 17-hydroxyprogesterone since 1995 with a global incidence of approximately 1 to 20,000. We screen also for sickle cell disease, but only on a selected population, which represents 30% of the global population of France. With a measurement of hemoglobin S since 1989, with a global incidence of 1 to 1,000. Cystic fibrosis, we measure IRT, DNA IRT since 2002, with a global incidence of 1 to 5,000. And finally, we screen for MCAD deficiency since only 2020, with a measurement of C8 and C10, with the first result, global incidence of 1 to 20,000. And for hearing screening, we measure auditory evoked potential at the clinical level, and since 2013, with a global incidence of approximately 1 to 1,000. What is the future of newborn screening in France? We plan to extend our program to 7 other inborn errors of metabolism with different amino acidopathies, different organic aciduria, and some beta oxidation defects. And we have another condition under evaluation, which is a severe combined immunodeficiency named SCID. And we must have a decision at the end of this year. So thank you very much for your attention. I invite my colleague, Dr. Groscher, for the presentation for Slovenia.